All right. I'm here at Croakey GO Heatwave Health in Sunshine with Simon Judkins, who's very recently the ex-president of ACEM.
Immediate past president.
Immediate past president of ACEM, the College of Emergency Medicine. So recently you guys declared a climate emergency in Hobart. You had a protest march. Why are you here today?
Well, I think since we declared the climate emergency, I think things have got worse. I think we look at what's happening in Sydney, and it is exactly what the scientists and the climate change, science has been telling us what's going to happen. It's a disaster there. It's a public health emergency. We know that people are suffering in Sydney. We know that they're increasing presentations to emergency departments with respiratory problems, all the mental health issues that come along with it as well. And so we're certainly, the messages we're getting from people working the EDs is that that there is a major health emergency going on in Sydney at the moment.
Yeah, so what are some of the things that they're seeing in Sydney?
Well, certainly increases in patients presenting with exacerbations of airways disease and asthma. That's the most obvious one. But of course, with the persistent heat, it can impact anybody with a chronic disease. So people with cardiac failure, with renal failure, but we're also seeing an enormous a spike in mental health presentations as well. So people are very, very concerned. People with chronic mental health issues, obviously, it increases their stress and anxiety. People are homeless as well. So it's really across the board.
So what are is there a contingency plan underway? This seems to be going on it's going to be going on for months if you sort of believe the reports. What's happening?
Well, there doesn't appear to be any contingency plan, and I think that's the concern. This is a time where I think we need national leadership. Certainly the messages coming through are deafening in their silence. We certainly haven't seen anything come out to say that this is a public health emergency. I think it is a public health emergency. I think the population of Sydney is being impacted, and there needs to be some leadership and direction as to what the health response is going to be.
And what sort of things do you think that needs to encompass? What would that look like?
Well, I think that needs to be certainly a recognition, at least from the government, that this is a major health problem, and the fact that they are, there may not be a lot of short-term solutions right now, but obviously investing in the longer-term solutions is incredibly important, and we certainly haven't seen that from this government at this point in time. So I think this is a clear, this was very predictable, and we knew that this was going to happen at some point in time, and now it's playing out right in front of us. So I think it's very, very hard for any government to deny that the impacts of climate change, and we're seeing the health impacts on a population basis right now.
And what does the health system need to sort of meet this challenge, you think?
Well, it's really quite difficult at the moment, isn't it? I think, all we can do from an acute response and acute perspective is make sure those people who are unwell are able to access the health care that they need. But if you're already working in a system where your hospital systems and your emergency departments are operating, at capacity, trying to cope with that surge is incredibly difficult. So we just need to make sure that all those people are, those departments are well resourced, but we also need to understand that the people working in the EDs are also under stress because it's their family, it's their friends, it's their property as well. They're getting sick. So we need to ensure that they're well supported. So, we may look at a national response where we ask, similarly to what we've asked about firefighters to come in and help, maybe we need to be getting medical teams from other parts of the country to come in and help out in New South Wales and just alleviate the pressure from, for the clinicians who are there at the moment. So we really, unfortunately, what we don't have is a really good handle on what's actually happening on the ground. And that's what we need. We need more data about the presentations. We need to understand what's happening in our hospital systems and our health systems. And there's a lot of people around the country who are willing to help.
Got to get it going.